Hello, Namaste. In this video, we will know about posterior urethral valve. It is the most common disease which causes poor urine stream. This disease happens only to boys and does not happen to girls. We'll begin by how our urine usually normally forms. In the urinary system, we have two kidneys, tubes attached to it that reaches the bladder. Bladder is the place where urine is stored. The function of the kidney is to filter out the waste products from the blood and form urine, which then travels through these tubes into the bladder, where it is stored and is eventually relieved during urination. The main function of the bladder is to store urine. The kidneys produce urine, which then flows into the bladder. The flow of urine in the bladder is unidirectional, that is, it cannot flow backwards. There are these special muscles in the outlet of the bladder that prevent leakage. As the bladder fills with urine, it expands like a balloon. Despite the bladder expanding, the pressure inside remains low, as you can see at the side of the screen. This is important for the comfortable storage of urine without the need for constant urination. When the bladder is full, nerve signals tell your brain it's time to urinate. This leads to the relaxation of the muscles around the outlet of the bladder to relax. At the same time, the muscles of the bladder will tighten and shrink, pushing the urine out. And contracts again, as you can see here. A normal bladder and a functioning bladder outlet is very important as it evacuates all the urine, or at least most of the urine, from the bladder outside the body without creating much pressure. This was how urine is normally formed, stored, and is eventually relieved. In PUV, which is present since birth, abnormal blockage in the outlet of the bladder obstructs urine flow. This can create difficulty in emptying the bladder completely and creates a blockage. This blockage creates an increased pressure, as you can see at the side of the screen. The blockage can lead to increased pressure inside the bladder as it attempts to push urine through the narrowed bladder outlet. This increased pressure can lead to thickening of the bladder walls, as you can see here. The bladder's muscles work harder to overcome the bladder obstruction, which can cause them to grow bulkier and less elastic. Now, because the bladder walls that are supposed to be elastic has become thickened, is unable to hold urine or can hold small amount of urine under very high pressure. The increased pressure can also affect the urinary passage and the tubes connecting the bladder to the kidneys. There's also a risk of urine flowing backwards into the ureters and even reaching the kidneys. This backward flow can damage the delicate structures in the kidneys, potentially leading to long-term kidney problems. The impact of posterior urethral valve (PUV) on the kidneys can differ significantly from one child to another. Some children are born with moderately damaged kidneys, while some may have more severe impairment. As a result, the impact of PUV on the kidneys may also differ. It can either be very less or it can be very severe. PUV develops in a male fetus during pregnancy. The blockage caused by PUV can hinder the proper development of the fetus's kidneys. This is because the kidneys, which start producing urine by around the 10th week of pregnancy, need to function and drain properly for normal development. If urine flow is obstructed, it can lead to increased pressure in the bladder and damage the delicate developing kidney tissues. In some cases, the obstruction and resulting kidney damage can be so significant that it puts the fetus's life at risk. There is a risk of the child dying inside the womb due to complications related to kidney. It may also happen that PUV remains undetected and can show up in difficulties such as problems with urinary retention. That is, the child may find it difficult to hold urine for a longer time, or there may also be poor urinary stream, as you can see on the screen. If undetected and left untreated, the continuous pressure and strain on the kidneys can lead to more severe complications, including kidney failures. However, with routine prenatal ultrasounds, PUV can be detected early. Early detection can be helpful and is crucial for planning appropriate management and interventions after birth to minimize complications. To relieve the child of immediate symptoms and prevent further damage, a doctor might insert a tube directly into the bladder. This tube helps in bypassing the obstruction in the urinary passage, allowing urine to flow out of the body. This is often a temporary solution, used particularly when immediate relief is needed or when preparing for more definite treatment. The most common and definite treatment of PUV is a surgical procedure where a surgeon uses a special instrument to remove the obstruction. This is typically done under general anesthesia. In cases where surgery isn't possible due to unavailability of instruments or other medical reasons, a doctor may create a small opening in the bladder. This opening allows urine to drain directly from the bladder to the outside of the body. In very special circumstances, particularly when the kidneys are at risk, the tubes that carry urine from the kidneys to the bladder may be brought out directly onto the skin of the belly. After any of these treatments, regular follow-up is important to ensure the urinary system is functioning properly. Even after successful treatment of PUV, there are residual effects on the kidneys due to previous obstruction and increased pressure. To minimize pressure on the bladder and kidneys, children are advised to empty the bladder every 2 hours. They are also suggested to double void, that is, after urinating, waiting a few minutes and then trying to urinate again. This technique helps in completely emptying the bladder, reducing the risk of urinary retention and decreasing pressure on the urinary system. For these patients, the doctor may also prescribe some medicines that can help the bladder to relax and again allow to hold urine at normal pressures. PUV can lead to kidney failure and is one of the common causes for pediatric kidney transplantation. Therefore, even though the treatment can help prolong the life of the kidneys and preserve the kidney function, regular follow-ups are very important to ensure that the child has a normal quality of life. Thank you.